ECGs of Ischemic Heart Diseases. You are back again with Medicineify Internal Medicine series, the ECG chapter. In this video, our aim is to provide you some examples of ECGs in patients with ischemic heart diseases. You can like this video and save for quick reference in future. Also, we recommend you to watch our ECG theory video before watching this. Alright, let's move on. Before reviewing common ECG patterns, let's brush up about leads of ECGs. Take a screenshot of this and save if you cannot remember this at first glance. Okay, so inferior leads, lead 2, 3 and AVF. Lateral leads, lead 1, AVL, V5 and V6. Anterior leads, mostly V3 and V4. Septal leads, V1 and V2. You need to remember this to identify where is the ischemia. Right. Let's see some common ECG patterns of ischemic heart diseases. Stable angina. Usually the resting ECG is normal, while exercise ECG shows this kind of ST depression. You can see the arrow point here. Take a screenshot if you want. ST depression in exercise ECG of stable angina. The bottom diagram shows how we are doing an exercise ECG. Please refer to our ECG theory video. We already explained about how we are doing exercise ECG. Let's move on. Another example shown here. Focus on the red circle. It shows ST depression. The first diagram above is shows the baseline ECG without exercise, and then ECG at stage 1 and ECG at stage 2 of exercise. And the last one shows the ECG at recovery. So we can clearly identify ST depression at when the patient is doing exercise. Alright, STEMI, ST elevated MI, myocardial infarction. As discussed in our previous video, these are the progressive changes that we can see in ST elevated myocardial infarction. First picture is normal ECG and the second one hyperacute stage, T wave tall and wide. We will see those in real ECGs in next slides. The third one ST elevation, and then Q wave appears and T wave inversion and ST depression back to normal, and then T wave also back to normal, but Q wave persists. That's the pattern. Okay, let's see some examples. STEMI, hyperacute stage, tall and wide, T wave. You can see in this left diagram arrow point, tall and wide T wave. And please refer to the actual ECG. Here the circle shows tall and wide T wave in inferior leads. You know that we discussed what are the inferior leads, 2, 3 AVF. Okay, STEMI, acute stage. Now you can see the ST elevation here. The red circle shows ST elevation in inferior leads, 2, 3 AVF. And the blue circles shows ST elevations in lateral leads, V5 and V6. We call this acute inferior lateral ST elevation. Okay. STEMI, acute stage. Another example. ST elevation can see in V1 to V6 plus in lead 1. Please refer to the circles. You can see V1 to V6, prominent ST elevation, and also a little ST elevation in lead 1 as well. Take screenshots of what you need, and also you can like this video and keep it saved for future reference as well. Next, STEMI, early stage. What you can see is Q wave. So pathological Q wave appears in the early stage of STEMI. You can see in the circle diagram. Alright, next, intermediate stage of STEMI. What is happening in that stage is T-wave inversion. You can see clearly T-wave inversion from V1 to V6 of this ECG. Right, the late stage of STEMI, what happens is T-wave back to normal, but the Q wave persists. So here in this diagram, in the inferior leads of 2-3 AVF, the T wave is back to normal, but the Q wave persists. Next, let's move to another ischemic heart disease, unstable angina. What happens with unstable angina? As you already know, it can be T-wave inversion or it can be ST depression. Here you can see ST depression very clearly. This is the ECG of an unstable angina patient. In leads of 2-3 AVF, inferior leads, and also V5 to V6, we can see clearly the ST depressions. Next, non-STEMI. What do you mean by non-STEMI? Non-ST elevated MI. So what happens? ST depression and T inversion can also be there. The diagram above shows how the ST depression and also T inversion happens in ECGs. And this example shows ST depression of a patient with non-STEMI, non-ST elevated MI. A non-STEMI with T inversion. You can see here in lead 1, 2, AVL, V4, V5, V6. Okay, the last one, left bundle branch block, LBBB. What happens in LBBB? William, W waveform in V1 and M waveform in V6.